Well, today on the show, we're at Saad Healthcare in D'Iberville, and we've been here several times talking about the great things that they do when it comes to home health care. They have a brand new program that they have just started, and we're talking to Diana Paff, who's the administrative assistant here. How are you?
Hi, how are you?
I'm wonderful. It's good to see you. I talk to you all the time.
Yes.
You've been here for 22 years?
Yes, sir. 22 years.
That's
great
wonderful.
Company.
They really are. They really are. Everyone that we, and you know, the funny thing is all the different times that we've been in here, pretty much the same faces.
Right.
Very low turnover. Yeah.
Yes.
Yeah, they really make you feel comfortable.
We do. We have several employees that's been here for 15 plus years. So it has been a great company, yes.
Well, you started a new program this year.
Yes.
And tell us about that.
Okay, well, first of all, as you all know, we have home health, hospice, and durable medical equipment. Well, about 6 months ago, we opened a certified nursing assistant school, which is awesome, and it's a way for maybe new graduates or someone that isn't able to decide what they want to do with their life. They may want to start off being a nursing assistant. And it's a 2-week period of class, and they come in and they learn the basic skills of being a home health certified nursing assistant. Yes.
Now, do they have to go through nursing school before they do this, or
no, this is prior.
Like I could go in there and do that.
Right. Yes.
Wow.
Like we go to the high schools and try to get the graduates that if they have an interest in coming in nursing, they may want to start off being a CNA first. So our class is a 2-week class, and like if they can go to a college and have this done too, but we are Mississippi State certified under the colleges here. So we just opened up, and the class, it costs like $530, and it lasts 2 weeks. And within those 2 weeks, you are in a classroom where you learn the knowledge, of course. And then you also will learn about the basic skills of doing personal care on a patient. So we have a class now. There's over 10 students, so we're doing very good.
And I noticed that the class is kind of small and intimate. You don't have like a huge hall full of people, and it's easier for the instructor to work one-on-one with each individual one.
Right. Well, as you know, Saad's is a family-owned business, so we are a family tradition of caring. So we care about our students too.
Well, good. Well, let's talk to the instructor of this brand new certified nursing assistant program here at Saad. Margaret Deal is the instructor here with the Certified Nursing Assistant Program. How are you? It's a pleasure to meet you.
Nice meeting you too.
Tell us a little bit about the program. I mean, I noticed that the class is kind of small and intimate. That kind of makes it a lot easier for them to learn.
Yes, it does. It's a 2-week program. We come from class from 8 to 5, Monday through Friday, the first week. And during that time, I'm lecturing usually in the morning and doing labs in the afternoon. The labs are going to consist of giving a bath, how to feed a patient, how to brush a patient's teeth, activities of daily living, okay? The second week, we come back to school Monday and Tuesday. We have classroom. Wednesday and Thursday, we go to a clinical site and do hands-on.
So you do clinicals.
Yes,
you go off-site and do clinicals.
Yes, sir. Yep, we go to Gaucher and do clinicals. We do hands-on to patients, giving them ADLs for the day and things like that, help feed, come up with a real-life type thing. This is basically a stepping stone for many of these young women and gentlemen that I've had in my class to find out if this is a career they want. It's very exciting and adventurous.
So none of these students that you have in here necessarily have gone to school for nursing per se.
No.
This is just kind of a beginning, a stepping stone, as you said, to see if it's something that they like to do.
Very rewarding.
Now, and I've noticed all the different things, that basic knowledge and skills, infection control.
Oh yes, we wash hands every day. There is a proper way of washing hands to prevent cross-contamination when you're out there taking care of patients, or even in your own home, or going to Walmart to watch.
Well, I peeked in on one of your classes. You're talking about doing blood pressure checks, and you're telling them wash after every patient. Your stethoscopes. It's like, okay, I can understand the part that you touch them with, but the part that goes in your ear, got to do that one too.
Yes. Yes, always preventing, because I'm going to another person to take care of them. So
Wow.
I might have got some bacteria in Mrs. Jones' room, but now I'm going to go see Mrs. Smith.
You teach them the Heimlich maneuver?
Yes, sir. Yeah, they get certified in CPR, everything.
environmental safety, body mechanics, psychosocial needs.
Yes.
Wow.
We just discuss everything. And, you know, and we even teach death and dying. And it's basically something that's hard for some
Yeah.
people, but it's something that we're going to all face with.
It's part of life.
Right.
It definitely is part of life. Essential nursing care knowledge, disease process, anatomy and physiology, body systems. You know, we mentioned blood pressure, vital
Yes.
signs, checking different things like that.
And you can ask them, that this is something we start very early, vital signs, because it is life. And these gentlemen and ladies learn how to do every part of it. I don't let them leave class until they know what they're hearing.
And then once they leave class, they are certified, and of course
They're certified, but they do have to take a state test, and that
Okay.
usually up with JD.
Okay. Now, and once they get certified, they go out with a regular nurse, or they.
Once they get certified by the state, okay, that's when they'll go and look for their employment. Nursing homes, hospitals, doctor's offices, and things like that.
Well, because I think in nursing assistant, I'm thinking, well, okay, I've got to go out with a regular nurse to do this.
Not
No.
unless they go, no.
Wow.
That's what they come to class into labs. That's how they get trained.
And I know, there is such a need for good
Oh,
nursing assistants nowadays, and especially down here on the Gulf Coast, because more and more people are coming down here to retire.
Yes.
And you see, a lot of the nursing homes are always, looking for good, reliable people.
The problem, what a nursing assistant does is they're the mediator for the doctor and the nurse, okay? They see the patients more. They see them undressed to give them a bath. So they're the ones that tell the doctor and the nurse what's going on with the patient.
That is amazing.
Thank you.
So we're going to let her get back to her classroom now.
Well, thank you.
And if you want some more information, the number to call is, you call Pam Heller. I'm looking at this thing here. This is call Pam Heller at 432-8855. And I guess that's the, actually call Diana Paff. You met her. Call Diana Paff, 432-8855, and she can give you some information. I'm sure there's probably some information on the Saad Healthcare website.
Yes.
On this brand new program that they have here. They talk about tuition, as you said. 2 weeks course includes 2 days of hands-on clinical practice and so much more.
Thank you.
This is fantastic. So, Margaret, thank you so much for sharing with us.
Thank you.
We'll let you get back to your classroom, your wonderful students here. So again, if you'd like some more information about this, it is absolutely fantastic. They're located on Iberville Drive in D'Iberville. Saad Healthcare is, and it is a complete course of training leading to certification as a certified nursing assistant. And upon graduation, she said, students are eligible to make the Mississippi CNA, take the CNA exam. So, could be a great new career for you. And it starts right here at Saad Healthcare in D'Iberville.